My name is Francesco Branca. I'm the Director of Nutrition in the WHO headquarters in Geneva. We have seen that in the last few years, the prevalence and level of malnutrition, of undernutrition, has been luckily decreasing. But then what we're seeing is an increase in another form of malnutrition, which is overweight. We start seeing it in children. We have now about 42 million children in the world who are affected by this form of malnutrition, but even more, we have about 2 billion adults who are affected by overweight, which is conducive to non-communicable diseases, diabetes, hypertension, heart disease. What we're seeing also is that these different forms of malnutrition coexist in the same countries. We have what we call the double burden of malnutrition. And the double burden can also be present in the same communities, in the same family. There is a combination, there's a connection between these forms of malnutrition, because biologically, a child who has malnutrition early in life is going to be an adult with a high risk of overweight and diet-related non-communicable diseases. They're also connected because they have common causes. If we have unequal access to the health services, that is responsible for both undernutrition and overweight. If we have a food system that doesn't deliver on the adequate needs of the population, then this is conducive to both undernutrition and overweight. But also solutions can be connected. We can deliver programs such as programs aimed at increasing exclusive breastfeeding until age 2 or beyond that can benefit both the undernutrition and the overweight. We can have programs that deliver essential nutrition actions to all people as part of universal health coverage, and that is certainly going to benefit multiple forms of malnutrition. We also need to design our undernutrition programs in a better way, better targeting, because inadequate targeting and inadequate implementation of this program can actually increase the risk of overweight later in life. We've had some interesting developments with nutrition becoming higher up in the political agenda of several countries, but we still need to have more of that. So political commitment at the highest level of government is still a need. That has to go also with adequate resourcing of nutrition programs. So the investment that countries are doing from their own budget is critical. And maybe in order to do that, we need better data on the nutrition situation, on the vulnerable groups, better data on policy and program implementation, and better data on the impact of malnutrition and of the investment to reduce malnutrition. We also need to have better capacities to deliver policies and programs. And this means working with countries closely, but also facilitating interchange and exchanges between countries who have had the same experience and who can maybe share the recipes on the good solutions.